Another health scare started in Jamaica on July 6. The health ministry confirmed the first case of the monkeypox disease, a man who had traveled to the island from the United Kingdom only days before. Now, the days and weeks that followed were troubling. From that patient going missing for several days, issues with contact tracing, and a second case being confirmed on July 24, a male who had traveled from New York. Now, with the World Health Organization declaring monkeypox a global health emergency, there is growing anxiety locally. I'm Herman Green, and this is PTN Plus, where we take TVJ's primetime news reports further. Now, most of the anxiety we are seeing stem from memories of the first case of COVID-19 in March 2020 and the spread of that disease thereafter. Now, to explore these concerns and get some answers, we're joined by Chief Medical Officer with the Health Ministry, Dr. Jacqueline Bisesa-McKenzie, and Public Health Specialist, Dr. Alverston Bailey. Doctors, welcome.
Thanks very much for having me.
Thank you.
All right, first of all, I'll start with you, Dr. Bailey. You have been quite vocal on the matter since our first monkeypox case. Comparing the first month of developments now with the first cases of COVID-19, what is your main concern?
Okay, I'm experiencing what I could call a deja vu feeling, in that the first case of COVID actually came from the UK, and the first case of monkeypox also came from the UK, and that's a little interesting. However, I'm also experiencing a feeling of optimism, in that whereas COVID-19 was a brand new infection with a lot of knowns and unknowns, with respect to monkeypox, this is a virus that was discovered in 1958. The first case was actually found in 1970, and it has been endemic in Central and West Africa for quite a while. And we've had sporadic outbreaks from time to time. So this is not a new virus. And also, we are at a special place right now in the world and in Jamaica where we are ready to take on any new and emerging diseases because we have learned our lessons. Learned our lessons in terms of testing, contact tracing, isolation, and quarantine.
All right, I noticed you said we have learned our lessons. Some persons might feel a little iffy about that statement. Dr. Bisesa-McKenzie, I bring you in here. One of the concerns of the general public had is the fact that the first patient went missing from the Maypen hospital for days. First of all, has the ministry confirmed how the patient left the hospital?
Well, first of all, I must say I'm not sure where you've gotten your reports, but the person was not missing for days. The person was missing for less than 24 hours. And the location of the person was known within the first few hours. So that story is a little bit wrong
well,
there.
I think he left the hospital Wednesday. We picked him up on Saturday. Something in that time frame. But do we know how he left? Do we know how he left the hospital? Let's say it was for a few hours. Do we know how he left the hospital?
Well, the final report, I have not personally seen the final report. The reports that I've seen has suggested that he left without permission and not through the regular route, not through the entrance to the ward. So what was in the public space was that he could have possibly have left through a window. And the initial reports that I have seen has suggested that the region has been doing their investigation. I've not seen the final report, but I've not seen anything else to suggest otherwise.
Okay, had the reports that some of his relatives were showing symptoms been confirmed, or can we speak to that? And how is contact tracing in relation to that first patient? How has that been going?
Well, we have all the contacts were quarantined. I think for both of the cases, both of them realized that they were ill quite early, and the number of contacts was not huge. So, and was within the household and the conveyance. So we would have been able to locate these persons and they would have been quarantined. We did get some early symptoms in some of the contacts of the first case, but their tests have been negative. So the range of symptoms can be quite varied. It starts out as a viral illness and can mimic several other illnesses, including COVID, because it starts out with fever, aches and pains, as well as some respiratory symptoms. So, you have to test to determine, because it's not everything will turn out to be monkeypox.
All right. There were questions or concerns about them being isolated at the hospital or quarantined at the hospital. Dr. Bailey, you had concerns about that. How do you think, do you agree with quarantining patients or isolating them at the hospital, or do you think they should be isolated at home?
Okay, my response to that is quite simple. The question of isolation depends on the severity of the illness. In many cases, monkeypox presents with fever, headaches, weakness, and large lymph nodes, and then it progresses to a rash, which can be on the face, on the hands and feet, it can be in the mouth, in the genital area, and in the eye. Now, in the majority of cases, no complications will have been detected. And the complications that we would be concerned about would be like pneumonia, inflammation of the brain, which is encephalitis, or generalized infection by bacteria. Now, if the patient did not develop complications, in my opinion, the patient should have been isolated at home if it was possible to do so. If it was not possible to isolate the patient at home, then a government designated isolation area could easily have been created for that particular person, because the treatment that you give persons with monkeypox is nothing as complicated as necessary for COVID-19. There's no need for high flow oxygen. There's no need for continuous monitoring. And so therefore, if the person does not develop complications and they can be isolated at home, then I think a government designated isolation area should have been put in place.
Do you agree? Do you agree with that, CMO?
Yes, that is clearly documented in our quarantine protocols and our infection prevention and control protocols. We admit patients who are sick and who are in need of medical attention. However, we may have to isolate persons outside of their home if their homes cannot accommodate the isolation. If you have small children sometimes in the home, if it is difficult, then we will put them in public facilities. So that is clearly documented. Those decisions are made on the ground by the public health team, who will do the necessary, first of all, the clinical investigation will determine if the patient is ill and needs to be hospitalized. And if not, it's the public health team that, based on their assessment of the local situation, will make a determination what is the best place to put the patient or the client. So that is clearly documented in our protocols that have been circulated widely.
Okay, good. Just give us an update on the second case that was confirmed. What's the situation with him? Of course, without giving too much personal information out. And does it still stand that we should not be worried about the cases that are here?
Well, I mean, worry is a strange word. I mean, we all have to be concerned. We don't want to have any kind of massive spread. We don't want it to have locally acquired cases. So we certainly want to prevent spread as much as possible. And certainly that has to do with, first of all, the recognition of persons on the ground, that this is there. They know the symptoms. They know where there is history of travel and contact with somebody who has been ill, that they have to contemplate whether it is that I could be developing symptoms. And first of all, to isolate themselves and then to contact the healthcare provider. So in terms of worry, we should be concerned.
Be concerned, but no panic.
Spread. Yes, I don't think there is any need for panic. The disease is, for the most part, a mild illness. It does last can go for up to 21, sometimes more days. So you do have to stay away from the public for a while, but most people recover without any issues at all. the immunocompromised persons are the ones that we have to be concerned about, that they may develop a more severe illness. I think in over the 15,000 or so cases, I think there have just been 5 deaths. So it's a very low mortality rate. So in terms of it really affecting our hospitalizations, I don't expect to see that. But it does keep the public health team busy because they have to monitor persons in home, especially if we think that there may be compliance issues.
All right, I want to bring back Dr. Bailey here. There is a growing view that monkeypox is predominantly transmitted among men who have sex with men. Is there any justification to that view?
Okay, it is justified in that with the present outbreak, if you were to look at the data from UK, 95.5% of the cases were seen in men who had sex with men. And when they were interviewed, 33% of them said they had more than 10 sexual partners over the past 3 months. So it does seem as if the index cases occurred in a network of individuals who were involved in exotic sexual practices. However, it's important to note that it is not that the disease is a sexually transmitted disease, but rather that it is a disease that is contracted due to close personal contact with individuals who have the lesions on them. Now, one of the good news about this is that because the cohort of persons who have been found to have come with monkeypox actually are highly motivated, they are in a there's a golden opportunity exists for them to access care and to seek treatment. The other point I want to emphasize is that monkeypox is not a gay disease. It's a disease of close contact and is a disease that can be transmitted through respiratory droplets and through coming in contact with linen, utensils, and so on. So therefore, I don't think we should stigmatize monkeypox as a gay disease, but rather accept the fact that it began in this population, accept the fact that this population can be targeted, can be tested, isolated, and quarantined, and the wider society must recognize that appropriate personal protective equipment should be used, like mask wearing, and sanitizing, and gloves if necessary, so that the disease doesn't spread to the wider community.
Okay. All right, we're almost out of time. I just want to touch on one more thing in terms of treatment or preventative measures. Should we be trying to source vaccines for monkeypox at this point in time? Dr. Cecil Mackenzie, has that conversation started?
Yes, the conversation has started. We do see the recommendation coming out of the WHO in terms of possible vaccination of close contacts. The vaccine is not widely available. We have started our discussion.
We really hope it doesn't get to a state where we have to really go on a mass scale of this, that we'll be able to control the virus as it is. That's it for another edition of PTN Plus. Now, my guests were Chief Medical Officer Dr. Jacqueline DeSesa Mackenzie and Public Health Specialist Dr. Alverston Bailey. Now, as I mentioned earlier, the World Health Organization activated its highest alert level for the growing monkeypox outbreak, declaring the virus a public health emergency of international concern. What this essentially means is that the WHO now views the outbreak as significant enough threat to global health, and a coordinated international response is needed to prevent the virus from spreading further and potentially escalating to a pandemic. So no doubt, the conversation about monkeypox will continue. I'm Herman Green. That's it for PTN Plus. Thanks for watching.